Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik NIkam. In this presentation, I am going to focus upon communication with a new patient. I'm a cardiologist, so I'm going to be talking about patients, but this can apply to any type of communication, whether we are dealing with a child, teenager, professional colleague, or business associates, or anybody for that matter, because the principles I'm going to discuss will apply to every situation. When someone wants to come and talk to us, they have some concerns, they have some questions that need to be answered, and they are seeking some help. So let us keep that in focus and let us focus from their point of view. What is it that they are seeking from us? So let's get into their shoes. Let's get into their shoes and try to understand their point of view. And since I'm talking about new patient, I'm going to be kind of expanding on how we evaluate a new patient, or when you come across a new person for that matter, and what are the things that will make them feel homely, make them feel sort of comfortable, make them relaxed. I mean, those are the key things. And this same thing applies to interviews also. And there are times when the interviewers will have such a solid rock face, you feel like you're already being intimidated by them, but that's not how you communicate with other people. So let us look at some of the important features that we need to be focusing upon. When we walk into a room, or when we get into a conversation, or when somebody walks into our office, we need to welcome them with a smile and introduce ourselves. Hi, I am Dr. Nik NIkam. I'm so delighted to meet you. Have a smile, shake hands, have eye contact, and compliment. I like your red dress. That's really good looking. That looks good on you. Please come on, have your seat. So we want to make them feel homely. We want to make them feel comfortable. So the first 7 seconds of introduction is going to tell the other person whether you are receptive to their visit and their concerns. And as a doctor, I think that's the most important thing we need to be focusing upon, is how well do we understand the patient, how well do we understand their concerns, and how do we address those concerns and make a plan of action for the concerns the patients come with. Okay. Whenever we introduce ourselves, we need to explain ourselves, because everybody walks around with a white coat. Everybody walking around with a white coat is not a doctor or a nurse or a technician. They all have different roles. So it is important for us to walk in and say, hello, Mr. Smith, I am Dr. Nik NIkam. I'm a cardiologist. I've been in practice for 35 years. I do various types of cardiology practices. We have a stress test, a nuclear exam, an ultrasound test. We can do all kinds of tests here. And let's talk about yourself. Tell me something about yourself. What is your background? What kind of work you do? And what brought you to the office today? And who is your primary doctor? So we need to connect with the patient, not just with their complaints or symptoms or something that is bothering them, but we need to connect with them as a human being. That I introduce myself as who I am, what I do, and I would like to know something about the patient. Okay, what kind of work you do, because that may have an impact on what their symptoms are, especially with the heart patients. And their interaction with the family and the surroundings may tell us a little bit about that person's personality, which will be quite useful in planning our treatment. So we need to connect with the human being, not just their, oh, I'm hurting with chest here, I'm having little pain here, I'm having shortness of breath, I'm feeling weak, I'm feeling dizzy, and I'm eating too much, I'm overweight, and I can't walk. We know all those things. Those are important, but then we need to have face-to-face conversation. So many times I see doctors staring into that like a notepad or a notebook or a computer monitor, not even looking at the patient. Throw all those electronic gadgets out. Maybe get a notepad and sit down and say, okay, Mr. Smith, tell me what are your concerns? 1, 2, 3, 4. Just list them to start with. So you're having chest pain, you've been short of breath, and you're not been able to get your weight under control. Okay, so let's talk a little more about these things. So ask the patients to expand on those things. Don't say, oh, the patient didn't tell me. This is a very familiar answer I get. I said, oh, the patient didn't tell me. No, the patient is not going to tell you anything. As a doctor, you are expected to get the answers from the patient. That's why you are an expert. You need to ask leading questions, open-ended questions. Not just something where they say, yes, no, yes, no. Do you smoke? No. I say, how long have you been smoking? How much do you smoke? We need more intricate answers. All right. Then the most important part of communication is dynamic listening. I wrote a book on stressless mind, and they have an entire chapter on just art of dynamic listening. This is something which is never taught in any schools or institutions, but this is something you need to focus upon. What is dynamic listening? That is active listening. It's not like you're looking at the computer and saying, yeah, I know what you're talking about. You didn't even look at the patient. You didn't even know what the patient was saying. But you are just looking at all the numbers and some of the introductory data from the computer, and you're already making up your mind without even communicating with the other human being. I mean, that's not going to help them to feel comfortable or feel confident with your ability to handle their problems. So dynamic listening should be 70% of your communication, and talking should be 30% or less, because it is the patient who has to do the talking, and you have to just put in leading questions, open-ended questions, so they can answer in a comprehensive manner, so you can try to figure out what exactly is going on with this person. You make notes when the patient is telling of the pertinent points, and you ask for clarification. You say you get chest pain when you walk. Could you explain to me a little more about this? How much can you walk before you get chest pain? Can you climb 2 flights of stairs? Do you get chest pain while you're sitting and watching television? So it has to be expanded. So we need to ask for clarifications and tell the patients to describe. Don't be satisfied with, I'm having chest pain for the last 2 days. It comes and goes and I don't know what it is. That's not going to help you making a diagnosis. After you have taken the history from these patients, let us summarize what their main concerns are. Okay, Mr. Smith, I think after getting all your history, let's see if we can summarize if you're on the same page. So you're 45 years old, you're concerned about your weight, you're concerned about your blood pressure, and you're concerned about your cholesterol, which has gone up recently, and you're concerned about this new exercise-related exertional chest pain. Is that correct? Did I miss anything? That question is so vital and important. Did I miss anything? And when we put down all these points, we concur with the patients. What are their concerns? What are their worries? And after that, what we do is we examine the patient. Then we clearly explain to the patient. Step by step what we're going to be doing. Mr. Smith, we have done the electrocardiogram, and we are going to be setting you up for a stress test. We're going to set you up for an echocardiogram, and you're going to be going to the lab today to get the blood work done. And all of these things will be given to you in a written form by my office staff, and it will tell you exactly where you get these tests, when you get these tests, and when the results are going to be back. So we're going to set you up for a follow-up appointment after the tests are done. So it is important to explain to the patient what our plan of action is. If we can't explain to the patient what our plan of action is, patient may not be having confidence as whether this doctor knows what to do or how to proceed with trying to diagnose what is wrong with him or her. So give them a written plan of action, which can be done by your staff members. You don't have to do it. Then it's always important to reassure the patient. Reassure the patient that you're going to be doing these tests, you're going to find out what is going on, and we're going to implement appropriate treatments and recommendations, and thank the patient for coming to you for a checkup. And always make sure you set up a follow-up visit so that you can go through all the results and decide what needs to be done. So I'm focusing mostly on the human communication part of it. Talking, which I told you is like 30% of the conversation. On your side, it should be less than 10%, and most of the talking should be from the patient side, and you ask leading questions. You have the art of dynamic listening, which should be the most important thing. You can have a notepad and write down what they are saying. Never bring these electronic gadgets or stare at the computer monitor while the patient is talking to you. That's the most disgraceful thing a doctor can do to your patient, as far as I'm concerned. I mean, that's my opinion. Anyway, hopefully this has been helpful to you. I have a 250-page PDF book called Cardiology Rotation Manual. Of course, you're not going to find this presentation there in that book, but there are a lot of useful information. You can send an email to drniknikam@gmail.com, and I'll be happy to send you a copy of this free PDF booklet. You have been watching Triple N Media. I'm Dr. Nik NIkam. Thank you so much. And please do subscribe to our YouTube channel. We have more than 300 lectures relating to the cardiology topic, and you can watch those and recommend them to your friends. Thank you so much. See you in the next presentation.